Hey everybody, Chad and Madden here with the Grow Your Practice podcast. And in this episode, I want to take a step back and talk about the historical evolution. So we're going to do a brief history of the evolution of marketing. It's going to be global within all of healthcare, but we're going to take, as you know, I'm a private practice physical therapist. So certainly there's going to be a bias in there towards knowing the history of private practice physical therapy, because I think it is a bit of an outlier. There is somewhat of a difference compared to other conservative healthcare verticals such as naturopathic medicine and podiatry, chiropractic care, dentistry, occupational therapy, speech, etc. So we'll talk about some similarities and differences. As much as I possibly can, I'm going to try to stick to an objective history in the beginning before I interject any thoughts or opinions or anything outside of a historical context. So the beginning, I'll be as objective as possible. In the latter end, I'll share my personal experience and what changes I've seen as well. In the end, really want to give you a historical context of how marketing is changing so that by looking in the past, you can more predictably see what's coming to us in the future as healthcare, essentially healthcare practice owners and marketers. So, as you know, where did physical therapy come from? Essentially, came from the polio epidemics in the late 1800s, and also World War I, and the invention or the creation of restoration aids. And in particular, after World War I, we were really physical therapists or reconstruction aides were really an extension of the physician, primarily working in hospital-based systems or within hospitals. Really good book to check out is, I believe it's called History of U.S. Healthcare by Thomas Locher. Some of it is polarizing politically. I would say the last 25% of the book. That's up to you if you want to read that or have comments and thoughts about that. The first 75% of the book is amazing at giving the history of healthcare in the U.S. over the last 200 years. In the 1960s, private practice PT started to come into existence. I believe right around that time, there were only a handful of states, maybe one or two, that had direct access. And I believe Nebraska was the first in the 1950s, 1954 off the top of my head, if that's correct. Over the years, where I'm at here in central Pennsylvania, there were really only one or two private practices initially, beginning in the 70s, and then it became more and more competitive over time. I know here in Pennsylvania in the 1980s, which was more than 2 decades before we received direct access here in Pennsylvania. I believe it was 2004 we received direct access. Pat Croce was extremely successful private practice owner in the greater Philadelphia area. I believe he had 40 locations, or maybe it was either 20 or 40 locations. Sports physical therapist. He wrote a few books. You can check them out. I believe his latest book was I Feel Great and You Will Too. But Pat Croce, before he became part owner of the Philadelphia 76ers, the great Iverson run, if you remember in the early 2000s, there was an owner who was at all the Sixers games, especially when they went to the finals, regardless of where you're at in the country, if you're an NBA fan at all. There's an owner with usually low profile. I'm not sure how to classify those glasses, but they were super unique. And then he had a red goatee, which was pretty memorable. But yeah, before the 76ers, before Comcast, I believe Pat Croce got a start as a private practice physical therapist. I don't believe that he actually did it. The key point of bringing him up is in the 80s, again, 20 years before direct access, Pat Croce had a marketing machine for his company, and And it was a direct to consumer. So he wasn't relying on physician referrals. He wasn't really behaving only as an extension of the physician. He had this PR machine, and I know they would have, many of the great Philadelphia athletes at the time, like Mike Schmidt, Dr. J, I think Eric Lindros, if you're a hockey fan, etc. The athletes like that um, they were going to Sports Physical Therapist Inc. And they were receiving their PT there, and they were working out there, etc. Again, Pat writes about this, but the key point there is, this gentleman was way ahead of his time with regards to marketing and going direct to the consumer. And unlike our contemporaries in, again, other conservative care markets where they didn't really have those physician referrals and they weren't an extension, they didn't begin as an extension of the physician. They were independent or had more autonomy from the beginning. Physical therapy really had to develop that over time. We had to wean away from solely relying on physician referrals because, when I first, and this is less historical context, right? So up until that point, the primary way, so let's call it 2000, up until 2000, the primary way, and again, Vision 2020 with the APTA, the primary way to grow a practice, the lifeblood of a practice, was physician referrals. So we were very dependent on them. And even when and this is where I'm going to switch over to personal interest and experience, in 2003 when I opened up, and the business plan was simply 5 new patients a week. It was really a self-employed business model at the time. What I did in the first 4 months of practice was pretty ridiculous. I won't have to do this again, but I did 37 physician luncheons. So just, going out there is 2 or 3 days a week, doing physician luncheons, waiting for the physician to come into the office, and hopefully I could persuade them in some legal and ethical manner to send me a trust-based referral, right? And then the idea at the time, and this pretty much this thought dominated the market, that we would get a physician referral, we would treat the patient so well that they would go back to their physician, thank them for referring them to us, and then we would get more referrals over time. And to be fair, that model worked pretty well for us on a small scale. So over the first 5 years in private practice, we grew from really 2 physicians referring to us up until our peak in 2008, where we had 200 different referral sources here in Central PA referring to us, a single site location. We were roughly 4,000 square feet. So 200 physicians a year, unique physicians. No physician represented more than 4%. And by the way, when I say physician, I mean physicians, nurse practitioner, PAs, et cetera. So professional clinicians that are referring to us. And that we hit an all-time high of 154 new patients referred to us in a month that were by way of physician referral in, yes, November of 2008. So then right around that same time, there was a rise. And if you remember, we hit a bit of a financial crisis. And if you followed any of the events that were happening for hospital healthcare systems, and in particular their executives, there was a major push to really capture as much of the referral cycle as possible. So major push for larger healthcare systems, capturing revenue, et cetera. And what that meant was healthcare systems and hospitals purchasing a physician. In the beginning, it was primarily family physician offices, but capturing their diagnostic imaging referrals, their lab testing, et cetera, and their auxiliary services such as physical therapy. So that began to happen here in central Pennsylvania in 2008. And you could literally, you can go back and see, again, the major events, the major marketing events for executives were talking about this idea of capturing more revenue. So what that did is very much create a problem, an obstacle, a barrier for independent private practice owners staying in business, right? Declining physician referrals. This has been documented 2003 to 2014. It was roughly a 50, I believe it's 53.6% decline in physician referrals to physical therapists for back pain. It was published in 2018 in the Journal of General Internal Medicine, and then recaptured again within one of the APTA periodicals. So that was a real problem for physical therapists, and it's somewhat what makes us unique, because our peers, our colleagues in conservative care, they already had to solve this problem 150 years ago, right? They had already faced this. So they couldn't rely on physician referrals. And we really had to go through that weaning process. And as late as 2015, which was the first event, the first PPS event, or any APTA affiliated subsidiary event, whatever you want to call it, but I think you know what I mean. So PPS 2015 was at Rose and Shingle Creek. At that point, that was the first time that I had ever attended an event not where I wasn't truly a practice owner. I was a practice owner at that time, but I was also representing Breakthrough. And that at that event, spoke with over, I was doing these little mini sessions where I was teaching marketing basics, and a lot of hardcore learning for me in a very short period of time, but it was great. It was just this huge learning curve. And spoke with well over 100 private practice owners individually. And the conversation at that time, again, this is 2015 for point of reference, was, wow, that really stinks that where you're at in central Pennsylvania. I can't believe 90% of the area physicians now work for the hospital system, one of 3 hospital systems. We don't have the POPs or the HOPS competition that you're going through. And right now we're doing pretty well. And so then I started to ask this question: within the last 12 months, what percentage of your new patients, your new plans of care coming through, are coming from, let's do 3 different buckets. One is physician referrals. The second one is your patient list. And the third one is cold traffic, or what we were calling, unique to PT at the time, direct access patients, but it really means cold traffic, right? So, and this kind of threw owners off at the time, and realized that, more than half of the country hadn't really started feeling the squeeze yet. I could see it happening, but it really hadn't taken full effect yet. And so the physician referrals, many practices were saying 70%, 80%, 90% physician referrals. The other thing that I commonly heard there is we get a lot of word of mouth referrals, although I didn't talk with a single owner that was tracking that in any meaningful way or measurable way at all. It was just kind of this gut feel that they had, seemed a little whimsical. So we're highly dependent on physician referrals, and I'm just glad what's happening to you in central Pennsylvania isn't really happening to me yet. So we started teaching courses, and our original course was Killer Marketing. We taught that course over 23 times. I don't do it any longer, although we're talking about potentially launching an updated one here with best practices from the hundreds of other owners that we've worked with in terms of their application of it in a more modernized marketing automated world. More on that in a bit, but that was 2015. And then what we've seen over the last 7 or 8 years is wide and mass adoption of marketing direct to the consumer. Again, this was somewhat forced upon us just because of external circumstances. So 120 years ago, we're very much an extent of the physician strictly in the hospital as a reconstruction aid. Over time, that lifeline went away, right? Unless we're a physical therapist working in the hospital system. And we've been forced to learn how to market direct to the consumer. And so 7 or 8 years ago, for private practice survival, we really had to learn how to do that, how to market, and market in a new way. And there were some pitfalls along the way. pitfall number one, and I have 3 or 4 written down here that I'll go through. Number one was this idea of a seesaw, or a roller coaster, where we get really busy. More than half of the private practices in the country are really solopreneurs. So that means, you're likely your only clinician. Maybe you have a part-time or another full-time clinician, but that's the extent of the practice. And if I reflect back on what I went through and then talking with other owners that are in that position, we get really busy treating, we drop the marketing ball, and then our new patients go down, and then we run out and we start marketing again. Or now we have to write a new email campaign, or a new online ad campaign, or whatever that may be. We run out to the physician offices like I was doing 18 years ago, if that's still possible in your area. But we're constantly balancing this treating and marketing. The next thing that happens, another pitfall, is blaming the media. So back in 2014, 2015, when we started with Breakthrough, the one thing that Carl Mattiola, co-founder here at Breakthrough, what he did was he surveyed a physical therapist about their marketing. And the one question that he asked was something along the lines of, what's the biggest waste of money that you've had in marketing your private practice? And I think the number was 35 or 38 unique answers, 37 unique answers, something like that. And initially in the survey, we didn't do much with this. And we saw everything on there. So billboards, radio, TV, patient newsletter, physician luncheons, swag like t-shirts and coffee mugs, online marketing, Google, SEO, Yelp, Yellow Page ads, print ads, just about anything that you could possibly imagine was an answer as the biggest waste of money. And it was pretty widespread, and equal weighting. So nothing really jumped out. The cognition for us, the aha moment, came from doing a similar survey, which was, what was the most successful thing that you've ever done marketing your practice? And oddly, it was nearly the same exact list, nearly an identical list. And so it probably took us 3 to 6 months, maybe somewhere in that range, of looking at this and, what is this really telling us? And the thing that jumped out after a while, the realization was, wow, as private practice owners, the only thing that we're really blaming in our marketing is the media. So, it's practice owner A can advertise on Google or Facebook or Instagram or YouTube and have an amazing result. Practice owner B is doing the same media, right? But maybe is off in their messaging, is off in their target market. Maybe they don't understand how to use the media. They don't get a result. And practice owner A says, greatest thing I'm doing is advertising here. Practice owner B says, the worst thing that I'm doing is advertising here. But both of them are agnostic, or they're not aware that there's more to the marketing formula than just media selection, right? So that's where we get into the market message media match. You've heard me talk about that here before. You've heard other owners talk about it here before, other experts as well. But that in order for marketing to work, that first principle is, we must pick a target market. And the more specific it is, the better. Number 2 is we have to select media that they're consuming, right? So if our target market is not on Facebook, we shouldn't be on Facebook. If they're not on Google, we shouldn't be on Google. If they are on Snapchat, I'll use a really bad example, which absolutely isn't true, but for some odd reason, if our target market was on Snapchat, then we should be using that media, or vice versa. If our target market is paying attention to what's in their mailbox, or they're reading a certain newspaper in our area or listening to a certain radio station, then we should be there. If they are on Facebook, if they are on Google, if they are on Instagram, if they are on YouTube, then we should be there as well, right? So that's the media component. And then the messaging is, and this is the third big pitfall, most of the messaging that we look at, not just in private practice PT, but all of conservative care, and frankly, all of not conservative care, which is, medications, injections, surgery, they do this as well, is the focus tends to be on themselves. So it's rather selfish once you become aware of it. Excuse me. But most of us, we buy media, we buy messaging that makes us feel good as a clinician, right? I went to school for years, I earned a degree, I have special certifications. Any advertising that I do, any marketing that I do, any positioning that I do within the marketplace is going to talk about how great I am. That's a recipe for wasted marketing dollars, right? What does work, what is significantly better, if we use messaging that is very lay, that is easily understandable, and that is really value based or trust based, but we deliver valuable information to our target market. For example, I could talk about if I were creating a marketing campaign ad hoc right now. We could talk about how we're the premier provider in our area. What does that mean? I don't know, but it makes us feel good. I could talk about how our clinicians teach how to treat on a national level. They've been published in physical therapy peer-reviewed journals. I could talk about how many of our clinicians have OCS or SCS or some other specialized credential, which is awesome for peer-to-peer recognition, but is inadequate in terms of the lay public understanding what that means, right? Or we could talk about, here are the top 3 exercises for back pain, right? Or a back pain workshop, or a book on back pain, or how to treat your own back, or something valuable to our potential target market, right? So anytime that we do that, the pitfall would be to talk about ourselves, to shine the spotlight on ourselves. The right way to market is to understand the conversation that's already going on in the customer's head, potential customer's head. By the way, that idea is from Robert Collier, Collier. If you want to swim upstream in your 1930s copywriting geek like myself here, but like me. But yeah, a better message is to focus on the patient, talk about the problem from their perspective, and deliver valuable goodwill content there, and ultimately positioning our practice, especially when we're talking about cold traffic and marketing direct to the consumer for people who aren't aware of who we are yet, or what our services and products can do for them. The other the key part of the evolution that we're seeing is 7 or 8 years ago, one of the initial things that I saw was this. So we all started doing direct to consumer marketing. There was a lot of throwing spaghetti at the wall and let's see what works. For many owners, that's really what they were doing, rapidly trying to solve this problem. And there was that initial focus on attraction. So how do we get people in our area to raise their hands and interact with our advertising? So when we focus on branding, or when we focus on advertising messaging that makes us feel good, we usually don't get a response, right? And you've heard me talk about the principles of direct response marketing on here within this podcast or on our webinars frequently. But the game number one was just to attract patients, right? Get them to raise their hand, register for a workshop, download a book, call our office, whatever the CTA, the call to action was. It's that attraction, right? It's the copy in the ad. It's nailing the ad the right way. It's having a campaign where we're capturing their information so we can have a future conversation with them. The other thing that we've talked about there more recently is the 5 levels of awareness. So most practice owners will say something along the lines of, I wish more people in my area knew what fill in the blank. Physical therapy, chiropractic care, massage therapy, personal training, dentistry, ophthalmology, whatever specialty you're in. I wish more people knew what we could do for them, how we could help them, right? And the right way to think about it, an evolving thought, which is really a 50-year-old thought that just came back in vogue recently, is the levels of awareness. And if you think about this, so we'll do a quick example here where I'm at recording this in the studio here in Central PA. Within a 10-mile radius, there might be 100,000 people. And let's say 5% of them have had shoulder pain within the last 30 days. So that would be 5,000 people. Now, obviously, we can't treat 5,000 people within the next month. We just don't have the infrastructure to do it. But would it not be nice if we broke those 5,000 people down into different categories, so we could help those that would most benefit from our service quickly, right? So on one end of the scale, in terms of awareness, we have very low awareness, right? This is the person who doesn't know what physical therapy is. Maybe they just registered that they can't put their belt on like they used to because of a shoulder problem, or they can't reach in the back seat. They can't sleep at night like they used to, right? But they're not thinking physical therapy. They're definitely not thinking Madden PT, right? Madden physical therapy in any way. They're not aware, right? So they're not aware of the problem. They don't know what impingement is, or even that they have impingement, if that's the case. And they're certainly not aware of what physical therapy can do. On the other end of the scale, we have extreme awareness, which is the person that has shoulder pain and came to us 3 years ago for shoulder pain, for impingement syndrome. We helped them achieve their goals. They were pain-free 3 years ago. They achieved all their range of motion goals and their strength goals, and they got back to full function. Now they have a flare-up, right? That person is they're a high level of awareness. It's a very easy offer. It's usually just schedule an appointment. They're probably even finding us and calling us or on their own. Or typically what happens is they'll Google Madden and Gilbert physical therapy and then just call us and schedule an appointment, right? That would be high level of awareness. Well, over time, we've learned to discern as healthcare providers that we need to really be, need to have lines in the water, to use a fishing analogy, in all levels of awareness, right? Not only our warm, our past patient list, but also completely cold traffic. And if we're looking for consistent growth over time, and if we want to have maximum, let's call it predictable practice growth, if that's the goal and we're looking for that consistency, then we have to build systems that address the full spectrum of awareness, right? We can't just have cold marketing. We need warm marketing and everything else in between. So after we nail the attraction, the next evolution, and this was kind of funny because 2 years ago, somebody told this to me, and I was like, I'm very aware that this is the problem. Marketing, attraction, isn't the real problem for most of us. And I know this might come across as controversial, but once you nail the ad and once you have people raising their hands, most of us drop the ball. We have leaks in the process. So, and what's happening there is there's a conversion component. So very good advertising, the best advertising in the world. Let's say you worked with the ad agency that did the whole Got Milk campaign. This is a hypothetical situation, but you have millions of dollars to throw at marketing. You get the best ad in the world. You're running ads in the Super Bowl and on the back page of the New York Times and everything else, and you've just created tremendous demand. Well, once you've done that, the next problem that arises is conversion. And for me, I started to hit on this in 2010, 2011, when I was posting some very simple YouTube videos I just looked the other day. We still get over 100,000 views a month on the channel, which is kind of crazy because I haven't really touched it in close to 10 years. But anyhow, those videos that I was posting in 2010 and 2011 for patients, some of them went viral. And to the extent that I think in 2014 or 2015, if you would have Googled the term sciatica, we were the only video to come up on that in the first fold. So you wouldn't have even had to scroll. That video just came up. Now that is long gone. Other YouTube creators have come on and far surpassed anything that we did. But what was happening is I was getting these very long emails from people who were desperate, who had tried everything, who had back pain and sciatica, essentially from all over the world: Europe, India, Australia, Canada, US, South America. It was kind of crazy, the reach that we had there. And it was, here's my diagnostic imaging. These are the results of the tests that I had. This is what I'm suffering. Can you help? And in the beginning, I was trying to, carrying on a lot of conversations via email, which is a very difficult medium to guide people in the right direction. And one day I just, looked at the immense amount of work that I was doing, trying to give the right advice and help people the right way. And also trying to figure out this new media, which was YouTube out. And I just started saying, hey, can you travel to Harrisburg? Like, how can you make it here? Like, are you able to do this? Surprisingly, it worked in a small percentage of cases where people figured out a way to travel here. And I would treat them. And every single time we had a traveler, I believe they did extremely well, achieve their outcomes. And then, we would set them up with a home program. And we didn't really have, Zoom as a tool. We had Skype at the time, which was kind of a weird media to use. But yeah, conversion was the problem, right? So, and it's still the problem today. We might not have the challenge of a conversion conversation with somebody who's living in California, flying across the country to Harrisburg, Pennsylvania for treatment, which we really had before. But, it's interacting with somebody who's responded to our ad and they live 13 miles away, right? Can we have, not only can you and I as clinicians have a meaningful conversation with that patient, but that, can our office, can our team members, can our marketers, can our callers, whatever you want to, our patient care representatives, can they have those meaningful conversations? And I can tell you right now, we are dropping the ball a lot across the board, regardless of our specialty as healthcare practitioners. And you need to look no farther than just audit any email, any text messaging, any phone calls that you're receiving. And, maybe you don't have a recorded call. Maybe you're just in the same office as your receptionist when he or she is having that conversion conversation. But that is the real problem for most of us. We're able to generate interest. We're able to generate patient demand with the right attraction, but we're dropping the ball on conversion. It is important that we have automation in place to help out with that. Two-way texting, that we're not getting lost in spreadsheets. I know our group, our marketing group here, we're fighting the spreadsheet battle pretty hard. The goal is that we're out of spreadsheets before the end of this quarter. And and that we're completely in software, which is the right way for any organization that is looking to grow and scale and be efficient and save time in particular, that we're in software. But that we're harnessing automation and software to help with those conversion conversations. But once we have that human interaction with the potential patient and a team member, we need to know what to say, how to have a meaningful conversation in a way that shows genuine interest, that builds trust in that potential patient, to the point that they actually schedule a plan of care with us, get the help that they need, follow through, and get back to normal again. So that's big kind of realization number two. And you're going to hear that more and more. We started talking about it a little while ago when I taught that initial course in terms of conversion. We primarily were focused on, this is back in 2014, what the clinician should be saying in the room, because I believe there's a lot of drop off there. But now it spans our entire team, that everybody is aware what to say and how to keep their focus on the patient and not let balls drop there in our marketing. And then finally, we need to be able to measure it all. And again, that's for us, that's why we went out of spreadsheets at our peak. I believe our group, we had 6 different spreadsheets for the different offices that we have, one tracking, one marketing initiative we had. And we were just, up to 50% of our marketing time, our man hours, were managing spreadsheets. So switching everything over to software so that we can measure what is going on, that we can actually see what is working well, where do we have drop off, where do we have, a clinician that needs some support and coaching with regards to that first appointment in the room, where they're actually converting over at a very high rate, like 90% plus. from free screens, discovery visits, IEs, whatever it may be, over to a full plan of care. And then where do we have outliers who are just, uber performers that are performing really well, that we can capture a best practice there and roll it out um, selfishly to the rest of our private practice, but also to you, the independent private practice owner that's trying to solve this as well. So essentially, there we're trying to do more of what works and less of what doesn't. But in order to do that, we actually have to have the data, the metrics behind what we're doing, and software is the answer to that. The practice of the future. What we're really looking at there is, solving that control and consistency. I know for us, and this was a really good problem we just had today, but in our last de novo clinic, which is less than 1 year old, we have, I think it's 1,800 square feet. Jan Grove is the clinical director there, DPT. She's done an amazing job. She's an awesome student, 3 full-time clinicians, and they're already up to, I think she just shared, they have 170 visits scheduled next week. And they have a wait list in that new location already. So we're trying, rapidly to hire another license there, facing the same problems that you are. But the thing that I commended her on was in a very short period of time, by mastering some key principles in patient demand, which is what we're talking about here in marketing, private practice marketing. She's developed that consistency. It's very repeatable, going back to the same systems and just keeping the systems running, and is able to fill her schedules and her space. The other thing that I noticed, in terms of practice of the future, is just building value within the community. I'm biased to workshops. That's what's worked for me in my 20 plus year physical therapy career, but that's not a new idea. That workshops, seminars, lectures, whatever you may want to call them, lunch and learns, they've been around for 150 plus years. You've heard me talk about Elizabeth Longfellow already, first female physician in the US, and how she was able to circumnavigate the AMA restrictions around advertising, where early AMA in the 1800s, early 1900s was, as a physician, you're not allowed to advertise, because they wanted to differentiate themselves from charlatans, or what's better known as snake oil salesmen, cure-alls, and people that were selling elixirs without a license. So that is still, it's still the way. It's, providing value within your community, using trust-based marketing as well. And I think you're going to hear more and more people talking about consistent patient demand, and also ways to do that save time. Because you and I, as private practice owners, especially those of us that are still treating day to day, there usually is better things to do with our time than focus on marketing and being on that seesaw roller coaster that I alluded to earlier. So we need to have systems in place, reliable processes, repeatable processes that allow us to get some time back, so we can focus more, working on the business, building systems in other areas like HR compliance, being able to hire, attract those future team members, provide training, focus on our finances, do planning of additional space or additional clinics, et cetera, but really have that time to work on our business versus turning the nuts and bolts into marketing. And I'll leave you with this. Change in particular, as we evolve over time, is not easy, right? Many times the change that we're going through, the pain of right now, if you're a Ryan Holiday fan, or you've been following the recent rise in stoicism, obstacle is the way type mantra, there is a silver lining on the other side of change. And I see private practice owners in general, especially over the last 2 years, being very resilient, being very much able to survive and adapt to the changing times. And if you go back 500 years to when we were primarily an agricultural based economy, essentially everywhere in the world, and a change came along, which was, I think it's Eli Whitney and the cotton gin. You had this new machine all of a sudden that could process, that could produce so much more than before. And it's very much the same way with the marketing tools that are coming along. 25 years ago, I didn't have a tool to communicate with 10,000 people at the same time, which today would be email, right? Or it could be, the social media platforms that we have today. We have an infinite amount of new cotton gins or innovations that allow us to market and communicate in a much better way, a much more efficient way than before. And I think the issue is, which kind of happened in the beginning of the Industrial Revolution as well, is we can become overwhelmed with all the new tools versus, just going back to the first principles, what works really well, what's working well, where do we see, another farmer using the cotton gin to its highest potential, and how can we mimic that? How can we learn from somebody that is using the new tools, the new machinery, better than everybody else, or essentially a best practice? And how can we adopt that? How can we learn from that? That's where my mind goes to. And I think those practice owners that are going to have consistent growth in the future, they're connected. They understand that there's no value in being an island, being out alone, figuring it all out themselves. That might result in a little bit of pride, but there's ego in the way there, and we can all learn as a group and adapt together much more quickly than we can as separated islands. So in the quest for patient demand, I think that's where everything is going. Anyhow, hope you enjoyed this probably 10, 15 minutes of objective history, brief history of the evolution of healthcare marketing, and also 25 minutes of me pontificating and ranting about. Nonetheless, thank you for putting the work in that you do as a conservative care private practice owner, and ultimately helping flip the pyramid, helping serve more people and help them avoid unnecessary medications, injections, surgery, diagnostic imaging, and really changing the healthcare system here for the better. Thanks for all you do, and take care.